Which of the following are examples of the principle of patient-centered care that is focused on respect, values, preferences, and expressed needs? Select all that apply. 1. Administer antihypertensive medications to patient daily. 2. Pulling the curtain around the patient bed before changing the wound dressing on the patient's leg. 3. Allowing the patient to ask questions and express his or her concern about surgery. 4. Explaining a colonoscopy procedure to the patient. 5. Working with the family to bring in ethnic foods that the patient prefers. Answer 2. Pulling the curtain around the patient bed before changing the wound dressing on the patient's leg. 3. Allowing the patient to ask questions and express his or her concern about surgery. 4. Explaining a colonoscopy procedure to the patient. 5. Working with the family to bring in ethnic foods that the patient prefers. Rationale, patient-centered care that is focused on respect, values, preferences, and expressed needs focuses on treating the patient with dignity and respect. A component is to keep the patient informed and involved in decision-making. Consider patient preferences and perspectives when planning care. An environment where the patient is respected focuses on quality of life. Which statement made by the nurse is an example of applying the principle of patient-centered care while focusing on alleviation of a patient's fear and anxiety? 1. Let's talk about the concerns that you have about going home. 2. I'll get the medication prescriptions for you before discharge. 3. I'll be back in 30 minutes to help you get cleaned up. 4. I'll make a referral to the home health nurse for you. Answer 1. Let's talk about the concerns that you have about going home. Rationale. Interventions that focus on alleviation of fear and anxiety are related to allowing the patient and family time to express fears and concerns. Understand the impact that illness will have on the patient's ability to care for himself or herself and often express worries about ability to pay for medical care. Identifying staff that can help with payment plans alleviates fear and anxiety. A nurse is presenting information to a management class of nursing students on the topic of groups of inpatient hospital services that have a fixed reimbursement amount, with adjustments made on the basis of case severity and regional costs. The nurse is presenting information to the class on which topic? 1. Utilization Review Committee. 2. Resource Utilization Group. 3. Capitation Payment System. 4. Diagnosis-related groups. Answer 4. Diagnosis-related groups. Rationale. Diagnosis-related groups, DRGs, are group inpatient hospital services for Medicare patients. Each group has a fixed reimbursement amount, with adjustments based on case severity, rural, urban, regional costs, and teaching costs. Hospitals receive a set amount for each patient based on the assigned DRG, regardless of patient's length of stay or use of services. DRGs are part of the prospective payment system. Which of the following nursing activities is found in a tertiary health care environment? 1. Administering influenza immunizations at the senior independent living facility. 2. Providing well baby care in the clinic run by the local community health department. 3. Admitting a patient following open heart surgery to the cardiovascular intensive care unit. 4. Working the triage desk in the emergency department. Answer 3. Admitting a patient following open heart surgery to the cardiovascular intensive care unit. Rationale. Tertiary health care is focused on treatment of disease and illness. Tertiary health care takes place in intensive care and subacute care units. Emergency departments are part of secondary acute care. Preventive and health promotion activities are part of primary care. Which of the following activities performed by the nurses are focused on the patient-centered care principle of physical comfort? Select all that apply. 1. Asking the patient what a tolerable level of pain is for him or her following surgery. 2. Providing a back rub at bedtime. 3. Offering the patient a warm washcloth for his or her hands before eating. 4. Teaching the patient about the new antihypertensive medication ordered. 5. Scheduling the patient's follow-up appointments on discharge. 6. Changing the bed linens for a patient who is experiencing diaphoresis. Answer 1. Asking the patient what a tolerable level of pain is for him or her following surgery. 2. Providing a back rub at bedtime. 3. Offering the patient a warm washcloth for his or her hands before eating. Rationale. Interventions for the patient-centered care principle of physical comfort are focused on care that increases the comfort of the patient. Responding to patients' need for pain medications and using nursing interventions that increase comfort are important. Teaching is focused on the principle of continuity and transition. Scheduling appointments is an intervention for access to care. The nursing staff is developing a quality program for the floor. Which of the following are nursing-sensitive indicators from the National Database of Nursing Quality Indicators that the nurses can use to measure patient safety and quality for the unit? Select all that apply. 1. Number of medication errors committed by registered nurses RNs. 2. Turnover rate of nurses on the unit. 3. Incidence of patient falls. 4. Number of certified RNs. 5. Number of emergency department admissions per year. Answer 2. The nurse is teaching the patient how to change the wound dressing at home. Rationale. Nursing interventions focused on transition and continuity provide patients with information about medications to take, dietary or treatment plans to follow, and danger signals for which to look after hospitalization or treatment. These interventions also provide patients and families with healthcare resources after discharge. Nurses on a nursing unit are discussing the processes that led up to a near-miss error on the clinical unit. They're outlining strategies that will prevent this in the future. This is an example of nurses working on what issue in the healthcare system? 1. Patient safety. 2. Evidence-based practice. 3. Patient satisfaction. 4. Maintenance of competency. Answer 1. Patient safety. Rationale. Near-miss events are events that could have caused a problem with patient safety had they not been stopped before patient harm occurred. Nurses who investigate ways to prevent near-miss events work on issues surrounding patient safety. Rehabilitation services begin. 1. When a patient enters the healthcare system. 2. After the patient's physical condition stabilizes. 3. After the patient requests rehabilitation services. 4. When the patient is discharged from the hospital. Answer 1. When a patient enters the healthcare system. Rationale initially focuses on the prevention of complications related to the illness or injury. After the condition stabilizes, rehabilitation helps to maximize the patient's level of independence. An example of an extended care facility is at 1. Home care agency. 2. Skilled nursing facility. 3. Suicide prevention center. 4. State-owned psychiatric hospital. Answer 2. Skilled nursing facility. Rationale, where they receive supportive care until they are able to move back into the community. A patient and his or her family facing the end stages of a terminal illness might best be served by 1. Hospice. 2. Rehabilitation center. 3. Extended care facility. 4. Crisis intervention center. Answer 1. Hospice. Rationale, the focus is on palliative care, not curative treatment. The advent of diagnosis-related groups (DRGs) and capitation has brought about many changes in how health care is provided and paid for. Because of these changes, the nurse is aware that today's managed care system has a. Ensured full coverage of health care costs. B. Assumed all of the financial risk involved. C. Allowed providers to focus on illness care. D. Caused providers to focus on illness prevention. Answer D. Caused providers to focus on illness prevention. Rationale. Managed care describes healthcare systems in which the provider or the healthcare system receives a predetermined capitated payment for each patient enrolled in the program. Capitation means that providers receive a fixed amount per patient or enrollee of a health care plan. The actual cost of care is the responsibility of the provider. In this case, the managed care organization provider assumes financial risk in addition to providing patient care. The focus of care of the organization shifts from individual illness care to prevention, early intervention, and outpatient care. Which activity performed by a nurse is related to maintaining competency in nursing practice? A. Asking another nurse about how to change the settings on a medication pump. B. Regularly attending unit staff meetings. C. Participating as a member of the Professional Nursing Council. D. Attending a review course in preparation for a certification examination. Answer D. Attending a review course in preparation for a certification examination. Rationale. Maintaining ongoing competency is a nurse's responsibility. Earning certification in a specialty area is one mechanism that demonstrates competency. Specialty certification has been shown to be positively related to patient safety. A patient tells the nurse that she is enrolled in a preferred provider organization (PPO), but does not understand what this is. What is the nurse's best explanation of a PPO? 1. This health plan is for people who cannot afford their own health insurance. 2. This health plan is operated by the government to provide health care to older adults. 3. This health plan provides you with a preferred list of physicians, hospitals, and providers from which you can choose. 4. This is a fee-for-service plan in which you can choose any physician or hospital. Answer 3. This health plan provides you with a preferred list of physicians, hospitals, and providers from which you can choose. Rationale. Preferred Provider Organization (PPO) plans limit the enrollee's choice to a list of preferred providers such as hospitals and physicians. A participant pays more to use a provider not on the preferred list. PPO plans focus on health maintenance. Which of the following are examples of a nurse participating in primary care activities? Select all that apply. A. Providing prenatal teaching on nutrition to a pregnant woman during the first trimester. B. Assessing the nutritional status of older adults who come to the community center for lunch. C. Working with patients in a cardiac rehabilitation program. D. Providing home wound care to a patient. E. Teaching a class to parents at the local grade school about the importance of immunizations. Answer A. Providing prenatal teaching on nutrition to a pregnant woman during the first trimester. B. Assessing the nutritional status of older adults who come to the community center for lunch. E. Teaching a class to parents at the local grade school about the importance of immunizations. Rationale. Primary care activities are focused on health promotion. Health promotion programs contribute to quality healthcare by helping patients acquire healthier lifestyles. Health promotion activities keep people healthy through exercise, good nutrition, rest, and adopting positive health attitudes. Which of the following nursing activities is provided in a secondary health care environment? A. Conducting blood pressure screenings for older adults at the senior center. B. Teaching a patient with chronic obstructive pulmonary disease pursed lip breathing techniques at an outpatient clinic. C. Changing the postoperative dressing for a patient on a medical surgical unit. D. Doing endotracheal suctioning for a patient on a ventilator in the medical intensive care unit. Answer C. Changing the postoperative dressing for a patient on a medical surgical unit. A nurse is providing restorative care to a patient following an extended hospitalization for an acute illness. Which of the following is an appropriate goal for restorative care? A. Patient will be able to walk 200 feet without shortness of breath. B. Wound will heal without signs of infection. C. Patient will express concerns related to return to home. D. Patient will identify strategies to improve sleep habits. Answer A. Patient will be able to walk 200 feet without shortness of breath. Rationale. Restorative interventions focus on returning a patient to his or her previous level of function or a new level of function limited by his or her illness or disability. The goal of restorative care is to help individuals regain maximal functional status and enhance quality of life by promoting independence. Which of the following describe characteristics of an integrated healthcare system? Select all that apply. A. The focus is holistic. B. Participating hospitals follow the same model of healthcare delivery. C. The system coordinates a continuum of services. D. The focus of healthcare providers is finding a cure for patients. E. Members of the healthcare team link electronically to use the EMR to share the patient's healthcare record. Answer A. The focus is holistic. C. The system coordinates a continuum of services. E. Members of the healthcare team link electronically to use the EMR to share the patient's healthcare record. A nurse is assigned to care for an 82-year-old patient who will be transferred from the hospital to a rehabilitation center. The patient and her husband have selected the rehabilitation center closest to their home. The nurse learns that the patient will be discharged in 3 days and decides to make the referral on the day of discharge. The nurse reviews the recommendations for physical therapy and applies the information to fall prevention strategies in the hospital. What discharge planning action by the nurse has not been addressed correctly? A. Patient and family involvement in referral. B. Timing of referral. C. Incorporation of referral discipline recommendations into plan of care. D. Determination of discharge date. Answer B. Timing of referral. Which of the following are common barriers to effective discharge planning? Select all that apply. A. Ineffective communication among providers. B. Lack of role clarity among healthcare team members. C. Sufficient number of hospital beds to manage patient volume. D. Patient's long-term disabilities. E. The patient's cultural background. Answer A. Ineffective communication among providers. B. Lack of role clarity among healthcare team members. A nurse newly hired at a community hospital learns about intentional hourly rounding during orientation. Which of the following are known evidence-based outcomes from intentional rounding? Select all that apply. A. Reduction in nurse staffing requirements. B. Improved patient satisfaction. C. Reduction in patient falls. D. Increased costs. C. Reduction in patient call light use. Answer B. Improved patient satisfaction. C. Reduction in patient falls. C. Reduction in patient call light use. Care designed to prevent further progression of a disease is termed A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Health promotion. Answer C. Tertiary prevention. Rationale. Tertiary prevention is defined as care that prevents further progression of disease. Primary prevention consists of health-promoting behaviors or activities that reduce the occurrence of an illness. Secondary prevention is early diagnosis and treatment of illness, e.g., screening for hypertension. Health promotion includes activities that develop human attitudes and behaviors to maintain or enhance well-being. The nurse is applying for a position with a home care organization that specializes in spinal cord injury. In doing so, the nurse is applying for a position in which care? A. Secondary acute. B. Tertiary. C. Continuing. D. Restorative. Answer D. Restorative. Rationale. Restorative care is designed to help the patient reach optimal recovery from disease or injury. Included in this type of care are cardiovascular and pulmonary rehabilitation, sports medicine, spinal cord injury programs, and home care. Secondary acute care involves emergency care, acute medical surgical care, and radiological procedures. Tertiary care includes intensive care and subacute care. Continuing care involves long-term assisted living, psychiatric care, and older adult daycare. Which of the following are true statements about magnet recognition for hospitals? Select all that apply. A. The magnet model is comprised of 8 interrelated concepts focused on leadership competencies. B. Nurses within magnet hospitals collect data on nurse-sensitive outcomes. C. The work environment promotes a sense of empowerment and autonomy of nurse. D. Magnet recognition is a designation for hospitals that are able to maintain a low registered nurse (RR) vacancy rate. E. Magnet is a special designation for hospitals that achieve excellence in nursing practice. Answer B. Nurses within magnet hospitals collect data on nurse-sensitive outcomes. C. The work environment promotes a sense of empowerment and autonomy of nurse. E. Magnet is a special designation for hospitals that achieve excellence in nursing practice. Rationale. Magnet status is a process and review in which hospitals participate that shows achievement of excellence in nursing practice. The designation is given by the American Nurses Credentialing Center and focuses on demonstration of quality patient care, nursing excellence, and innovations in professional practice. Which of the following people is most likely to benefit from participation in respite care? A. Mr. Wilson, who was discharged last week with repair of a fractured hip from a fall. B. Mrs. Allen, who is the caregiver for her husband with Alzheimer's. C. Mrs. Bradley, who is the mother of an 8-year-old child with chronic asthma. D. Mr. Hillard, who has diabetes and a left heel pressure ulcer. Answer B. Mrs. Allen, who is the caregiver for her husband with Alzheimer's. The patient is to be discharged home from a tertiary care center later in the week. Therefore, the nurse A. coordinates referral of patients to services provided by other disciplines. B. monitors the patient's progress through discharge. C. cares for patients after discharge. D. anticipates and identifies patient needs. Answer D. anticipates and identifies patient needs. Rationale. Nurses play a large role in discharge planning. To achieve continuity of care, nurses use critical thinking skills and apply the nursing process. To anticipate and identify the patient's needs, nurses work with all members of the multidisciplinary healthcare team. The case manager coordinates the referral of patients to services provided by other disciplines and monitors the patient's progress through discharge. In many settings, a case manager continues caring for patients after discharge from acute care facilities. The nurse is serving on the hospital's Quality Improvement Committee. As the nursing representative, the nurse focuses quality improvement measures on A. outcomes unrelated to patient satisfaction. B. Desired health outcomes. C. Factors solely affecting inpatients. D. Increasing patient-to-nurse ratios. Answer B. Desired health outcomes. Rationale. Nursing plays an important role in quality and safety in healthcare. Quality healthcare is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. Healthcare providers define the quality of their services by measuring healthcare outcomes that show how a patient's health status has changed. Many of the aspects reflected in patient satisfaction apply to almost any healthcare setting. Research has found that hospitals that improved the nursing work environment and lowered nurse-to-patient ratios by one patient had higher patient satisfaction levels and patients who were more likely to recommend the hospital to others. The nurse is trying to determine how well a certain health plan compares with other health plans. To gather this type of information, the nurse utilizes the Healthcare Effectiveness Data and Information Set (HEDIS). B. Centers for Medicaid and Medicare Services (CMS) standards. C. Pew Health Professions Commission report. D. American Nurses Credentialing Center (ANCC) Magnet Recognition Program. Answer A. Healthcare Effectiveness Data and Information Set (HEDIS). Rationale. Health plans throughout the United States rely on the Healthcare Effectiveness Data and Information Set (HEDIS) as a quality measure. HEDIS compares how well health plans perform in three key areas: quality of care, access to care, and patient satisfaction with the health plan and doctors. CMS created quality standards for healthcare facilities as well as healthcare providers. The 1998 Pew Health Professions Commission recommended 21 competencies for healthcare professionals. The Magnet Recognition Program recognizes healthcare organizations that achieve excellence in nursing practice. A nurse working in tertiary care would work in which of the following settings? A. Hospice unit. B. Intensive care unit. C. Occupational health clinic. D. Cardiac rehabilitation center. Answer B. Intensive care unit. The student nurse is reporting to her group in post-conference about her observational rotation in the intensive care unit. The student states that it seems so much easier than floor nursing because everything is automated. There are machines that take vital signs and regulate IVs. The instructor's best responses to A. Agree with the student's evaluation of ICU nursing. B. Agree that IV pumps have made IV therapy totally safe. C. Disagree, stressing the importance of taking vital signs themselves. D. Disagree, stressing the importance of the nurse's judgment. Answer D. Disagree, stressing the importance of the nurse's judgment. Rationale. The instructor cannot fully agree with the student's statements. In many ways, technology makes the nurse's work easier, but it does not replace the nurse's judgment. An electronic infusion device provides a constant rate of infusion, but nurses need to be sure that they calculate the rate correctly and troubleshoot problems. Electronic equipment may take vital signs, but it is the nurse's responsibility to interpret the vital signs in relation to the patient's condition. When the nurse first meets the patient, it is important to establish a dialogue. If possible, patient-centered care stresses that it is important for the nurse to recognize that A. Patients usually want to rely on the nurse for patient care. B. Patients usually want to keep their fears and concerns to themselves. C. It is important to identify patient expectations. D. Patients usually have insurance and do not worry about finances. Answer C. It is important to identify patient expectations. Rationale. It is important for nurses to recognize the need to identify patient expectations in patient-centered care. The 7 dimensions of patient-centered care indicate that patients and family members want to know how to manage their care on their own. They also look to care providers to share their fears and concerns. One concern is their ability to pay for their medical care, and patients identify staff members who will help alleviate this worry. The nurse is feeling overwhelmed by the constant changes that are part of nursing in the healthcare system in general. Understanding that changes are necessary, the nurse needs to be aware that A. The nurse has no control over the changes but needs to accept them. B. Quality improvement depends on active participation of nurses. C. Belonging to nursing organizations will help bring the right changes. D. Active participation in nursing organizations will have no effect on change. Answer B. Quality improvement depends on active participation of nurses. Rationale. Professional nursing is an important player in the future of healthcare delivery. The solutions necessary to improve the quality of healthcare depend largely on the active participation of nurses. Thus, nurses have potential control over healthcare changes. Belonging to nursing organizations is a start, but simply belonging is not enough. Active participation is needed. The setting of healthcare services that includes blood pressure and cancer screening is which care? A. Secondary acute. B. Preventive. C. Tertiary. D. Restorative. Answer B. Preventive. Rationale. Preventive care includes blood pressure and cancer screening, immunizations, poison control information, mental health counseling, and crisis prevention. And community legislation. Secondary acute care involves emergency care, acute medical surgical care, and radiological procedures for acute problems, e.g. X-rays, CT scans. Tertiary care includes intensive care and subacute care. Restorative care deals with cardiovascular and pulmonary rehabilitation, sports medicine, spinal cord injury programs, and home care. Health promotion programs focus on A. Reducing the cost of health care. B. Controlling risk factors for disease. C. Immunizations. D. Occupational health programs. Answer A. Reducing the cost of health care. Rationale. Health promotion programs lower the overall costs of health care by reducing the incidence of disease, minimizing complications, and thus reducing the need to use more expensive healthcare resources. In contrast, preventive care is more disease-oriented and is focused on reducing and controlling risk factors for disease through activities such as immunization and occupational health programs. A patient who needs nursing and rehabilitation following a stroke would most benefit from receiving care at A. Primary care center. B. Restorative care setting. C. Assisted living center. D. Respite center. Answer B. Restorative care setting. Rationale. The goals of restorative care are to help individuals regain maximal functional status and enhance quality of life through promotion of independence and self-care. Technological advances in healthcare. A. Make the nurse's job easier. B. Depersonalized bedside patient care. C. Threaten the integrity of the healthcare industry. D. Do not replace sound personal judgment. Answer D. Do not replace sound personal judgment. Rationale. In many ways, technology makes your work easier, but it does not replace nursing judgment. For example, it is your responsibility when managing a patient's IV therapy to monitor the infusion to be sure that it infuses on time and without complications. An electronic infusion device provides a constant rate of infusion, but you need to be sure that you calculate the rate correctly. The device sets off an alarm if the infusion slows. making it important for you to respond to the alarm and troubleshoot the problem. Technology does not replace your critical eye and clinical judgment. The nurse observes that numerous patients on a medical surgical respiratory unit seem to have increasingly frequent readmissions. What quality improvement step could the nurse implement to explore the readmission rate? A. Inform the unit manager of the concerns. B. Evaluate trends and develop a plan for improvement. C. Contact the hospital quality improvement nurse to create an improvement strategy. D. Post a journal article on the unit that addresses national readmission rates for respiratory disorders. Answer B. Evaluate trends and develop a plan for improvement rationale to meet the quality improvement competency. Nurses are expected to use data to monitor the outcomes of care processes and use improvement methods to design and test changes to continuously improve the quality and safety of healthcare systems. www.qsen.org. Options A and D transfer the nurse's direct involvement in quality improvement processes. Option C may be an appropriate intervention at a later time, but the nurse should first evaluate the problem using data prior to developing a strategy for improvement. Government-instituted programs designed to control health care costs include: select all that apply. A. Professional Standards Review Organizations (PSROs). B. Prospective Payment Systems (PPSs). C. Diagnosis Related Groups (DRGs). D. Never events. E. Third-party payers. Answer A. Professional Standards Review Organizations (PSROs). B. Prospective Payment Systems (PPSs). C. Diagnosis Related Groups (DRGs). Rationale: the federal government, the biggest consumer of health care, which pays for Medicare and Medicaid, has created professional standards review organizations (PSROs) to review the quality, quantity, and costs of hospital care. One of the most significant factors that influenced payment for healthcare was the Prospective Payment System (PPS). Established by Congress in 1983, the PPS eliminated cost-based reimbursement. Hospitals serving patients who received Medicare benefits were no longer able to charge whatever a patient's care cost. Instead, the PPS grouped inpatient hospital services for Medicare patients into diagnosis-related groups (DRGs). In 2006, the National Quality Forum, not a government agency, defined a list of 28 never events that are devastating and preventable. Through most of the 20th century, few incentives existed for controlling healthcare costs. Insurers or third-party payers paid for whatever healthcare providers ordered for a patient's care and treatment. The nurse is evaluating the falls program instituted on the medical unit to decrease the number of falls. The number of falls has decreased in the last month. The nurse realizes that select all that apply. A. The program has been successful and can be terminated. B. Policies for the program need to be developed or evaluated further. C. The program evaluation is a nursing-sensitive outcome that can enhance safety. D. The program results need to be reported to the Chief Committee only. Answer B. Policies for the program need to be developed or evaluated further. C. The program evaluation is a nursing-sensitive outcome that can enhance safety rationale. Nurses in healthcare facilities use nursing-sensitive outcomes to improve nurses' workloads, enhance patient safety, and develop sound policies related to nursing practice and healthcare. Nurses who work in a skilled nursing facility need nursing expertise in which of the following areas? Select all that apply. A. Gerontological nursing. B. IV fluid management. C. Ventilator management. D. Depression, violent behavior management. E. Wound care management. Answer E. Wound care management. A. Gerontological nursing B. IV fluid management C. Ventilator management. Rationale. An intermediate care or skilled nursing facility offers skilled care provided by a licensed nursing staff. This often includes administration of IV fluids, wound care, long-term ventilator management, and physical rehabilitation. Patients receive extensive supportive care until they are able to move back into the community or into residential care. Nurses who work in a skilled nursing facility need nursing expertise similar to that of nurses working in acute care and patient settings, along with a background in gerontological nursing principles. Patients who suffer emotional and behavioral problems such as depression, violent behavior, and eating disorders often require special counseling and treatment in psychiatric facilities.